my NG insertion video. So the first thing I'm going to do is make sure that there is an order for an NG tube insertion. After that, I'm going to go over the nursing care plan, and then I'm going to perform hand hygiene, put on any PPE if indicated, and then go and identify the patient, verify their name and date of birth. At this time, I'm also going to explain the procedure to them, let them know that it will be uncomfortable, but it should provide more comfort once the NG tube is in the correct place. And then I'm going to also ask them if they are interested in having any nasal spray or topical anesthetics just to help with the procedure. And then I'm also going to ask them to occlude each nostril and breathe in and out of it, and then let me know which nostril is easier for them to breathe out of. So my patient informed me that their left nostril is easier for them to breathe out of, so I'm going to use that one for the insertion. And I'm going to go ahead and raise the bed to a good working height. And I'm going to put them at a 45-degree angle in the high Fowler's position. And then I'm going to get rid of the spread rail to make it easier for me, and then I'm going to put on some gloves. I have selected the correct tubing for this patient, and then now I'm going to go ahead and measure from the earlobe to the tip of the nose and then to the xiphoid process, and then I'm going to put a piece of tape on that to mark it. And I'm going to measure this just for future tube insertion. So I'm at about 510 centimeters. And then I'm going to give my patient some tissues, an MSS basin, and then cover them with a waterproof pad just in case anything spills. And I'm going to get them a cup of water. And before I start the insertion, I am going to use a water-soluble lubricant on about 2 to 4 inches of the side that's going into their nose. So first I'm going to ask the patient to tilt their head back as I insert. And then once it gets to about the pharynx, I'm going to have them put their chin to their chest and then start drinking some water. And if they were coughing or gagging at that point, I would use a tongue blade and a flashlight to make sure it's in the right place. So now that I have inserted the tube up until my marker, I'm going to loosely secure it to their nose until I can double check that it's in the correct place. So 2 ways to check that it's in the right place is to either get an x-ray or aspirate some stomach content, which I'm going to do. So we're going to aspirate some and then put on the pH paper. And the pH strip says that it's less than 5.5, so that is in the stomach. So we're going to hook that to suction, because that is in the correct place. And then now we are going to get some skin protectant and officially secure it to their nose. Now that it's secured to their nose, we're going to secure it to their gown, and I'm going to have my patient turn their head both ways to make sure that I'm not making it too tight and that they still have some range of motion. And I'm going to secure it with the safety pin and turn the suction on. And then I'm also going to remind them that we're going to be performing oral care every 2 to 4 hours just to help with bacteria and keeping their mouth moist. And then you're going to go ahead and document the amount of tube inside, the amount of tube outside, the type of tubing used, the size of tubing, and the patient's response to the procedure. So then now we're going to go on and then go to the removal. So with the removal, you're going to do the same thing. You're going to have your waterproof pad, your MSS basin. We're not going to use the water, and we're going to go ahead and turn the suction off. And then you're either going to insert 10 milliliters of saline, or you're going to insert 30 to 50 milliliters of air just to clear the tubing. And then you're gonna remove the tape. And then you're going to ask the patient to take a deep breath in and then hold it. And then you are going to remove the tubing. You also would have undid it from the patient's gown. And then you're going to throw this away, remove all of this, put the patient back to a comfortable position, and then you are going to help them with any oral care needed. And then you're going to clean up and perform your hand hygiene.